Adults Aphasia, Group 7, by Callie Allen, Arlen Boothberg, Shalini Gaskin, and Tyler. So you may ask yourself, what is aphasia? Aphasia is a language disorder that hinders a person's ability to communicate. Aphasia can happen suddenly after a stroke or head injury, affecting a person's ability to express and also understand written language. So this is just a video with the neurologist talking about aphasia, and one of the stars that you may know is Bruce Willis. He has it and just does a rundown about aphasia.
New and existing customers can choose the phone they want, like the incredible iPhone 14 on us.
Not to brag, but I'm on Verizon now. And I got to choose the phone I wanted for free. Not that you're bragging.
Choose the phone you want on us. Verizon.
Joining us now is Dr. Gayatri Devi, a professor of neurology at Hofstra University. Dr. Devi, good morning to you.
Good morning.
We know you haven't treated Bruce Willis, so but just generally, because a lot of folks are saying aphasia, I'm not sure they've heard that. What is aphasia?
Aphasia is when you have trouble communicating with another person. You know, whether you're doing it through sign language, through writing, or through speaking, you're not able to communicate your thoughts in some cases, be able to understand what someone else is telling you.
Is it really obvious? Because we all kind of can't remember things. Is it something that you listen to somebody and say, wow, there's something really wrong here?
Sometimes it's subtle. Sometimes you think, oh, is this person deaf? Can't they not hear you? And sometimes it's much more apparent where you're clear that the person's really having trouble speaking, or they really aren't understanding what you're telling them. Now there's
And also you can just go back to the video. She just gives a few points about it.
All right. So some of the statistics is that the prevalence is about 1/3 of people with strokes result in aphasia. There are at least 2 million people with aphasia in the USA. Gender ratios, in a study, they found that 61% of participants were men and 38% were women. But on the National Institute of Health, they said that aphasia was higher in women than men. So I think it just depends, but regardless, it's still pretty close for the gender. The incidence, there's estimated that roughly 100,000 and 100,000 people acquire aphasia each year in the United States. And then the age ratio, the mean age during the study of aphasia was 58 years old. So it is an older disorder. Some of the race statistics is aphasia can happen to anyone, but African Americans are at least 4 times more likely to have a stroke. So just because of that statistic, that it kind of stands out more that African American adults have an increased risk for aphasia.
So symptoms. A person with aphasia may speak in short or incomplete sentences, speak in sentences that don't make sense, substitute one word for another or one sound for another, speak unrecognizable words, have difficulty finding words. They may not understand other people's conversation. They may not understand what they read, and sometimes writing sentences that don't make sense.
The causes of aphasia. The most common cause of aphasia is brain damage resulting from a stroke. The stroke causes a blockage or rupture of a blood vessel in the brain, which leads to a loss of blood in the brain, which causes damage to the brain in areas that control language. Stroke is not the only cause of aphasia. Brain damage leading to aphasia can be caused by severe head injury, tumor infection, or degenerative disease. Complications in people with aphasia. Communication is the biggest complication for someone with aphasia. Other difficulties can include problems with memory, thinking, and difficulty moving around. Communication is such a big part of everyone's day-to-day life. So of course, for someone with aphasia, there are going to be complications when it comes to their everyday life. Complications in their communication can affect their work life or something as simple as ordering at a restaurant. Oftentimes, since they have trouble communicating, it can lead to embarrassment, frustration, isolation, and depression. And here is speech therapy after a stroke.
We've been working with speech therapy for a little while now, okay? And I just wanted to briefly review, what we're doing here in speech therapy. Okay, a lot of times, people might think speech therapy, what do I need speech therapy for? I speak fine. But in actuality, speech therapy kind of encompasses so much more than just the act of talking. So typically when a patient is admitted on the stroke unit or the head injury unit, we'll evaluate a multitude of different skill areas, including swallowing disorders, including speech, language skills, voice ability, and also something called cognitive linguistic skills. Okay, so what that incorporates is everything from your ability to maintain attention, concentration, problem-solving skills, short-term memory, working memory, all the way down to something called deductive reasoning skills. So that's the main area that we've been addressing since you've been here. It's not that you have any swallowing trouble, no speech issues. It's more, focusing on that short-term memory, that divided attention to help, with things like multitasking when you're at home or at work. And we do that, as you know, with a multitude of different activities. Okay, so.
And you can watch the rest later.
Okay, so some of the treatment aspects, the main goals for speech therapy for these patients is improving, just how she said in the video, you want to improve the remaining language abilities, restore language abilities, and learn communication types. Some indirect therapy, there's clubs or groups. This can help them gain confidence and practice communication. And then also you really want family involvement. This could be the family using simple language, including them in conversations, and minimizing distractions whenever you're trying to have a conversation. Some types of therapy, you can have short-term memory and attention, mental representations of sounds and words. And this just makes people with aphasia easier to access and receive that therapy. Like I said before, therapy can be group or individual. The patient improvement depends on age and health as well. That if they're not as healthy, they might not improve as well as a healthier person would.
So types of aphasia, one of the most common ones is Wernicke's aphasia. It is a language disorder that makes it hard for you to understand words and how to communicate. This type of aphasia is also known as sensory or fluent aphasia. Most people with this type of aphasia can't understand words, and words don't make sense to them. A lot of times people will be able to see words, but they don't know what they mean. Other than language, it can also cause problems with reading and writing. And then some causes and symptoms for Wernicke's aphasia. Some causes are strokes, head injury, brain infection, encephalitis. Some symptoms are words that don't make sense, unable to understand the meaning of words, able to speak well in sentences but don't understand, trouble writing, and frustration.
This is just a little video of Wernicke's aphasia. This is a patient that has it.
Hi, Byron. How are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment, talk with the people over them over there. They're diving for them at the moment. They'll save in the moment. He'll have water very soon. Yeah. With luck.
So we're on a cruise and we're about to
We
get
will
to June.
sort.
So you can kind of see there's a little clip bit, and this patient also thinks that he's just talking normal. So he gets very frustrated when people don't understand him.
Next up, we have Broca's aphasia, which is located in the frontal lobe, and it is named for Pierre Paul Broca. This type of aphasia is also known as expressive. People who have Broca's aphasia are able to understand what is being said but do not speak fluently. A lot of people who have Broca's aphasia tend to be also very frustrated. And then here are some signs and causes as well for Broca's aphasia. Some signs may be poor absent grammar, difficulty forming complete sentences, omitting words, difficulty using verbs, trouble writing sentences. Some causes are stroke, brain tumor, injury to brain, infection to the brain, and Alzheimer's disease, which is also one of the more common ones.
This is a little video of Broca's aphasia. So you can listen to how this man speaks.
Can you tell us your name?
Mike Caputo.
And Mike, when was your stroke?
I was 7 years ago,
Okay. And what did you used to do?
Worked Autodesk, 7 sales and worldwide, and very good. Yeah.
Okay. And who are you looking at over there?
So you can just watch the rest of that video. It's on YouTube, but I thought it was really interesting to see how they are in like a real patient.
So this is conduction aphasia. The signs of conduction aphasia is repeating words or phrases, some difficulty retrieving words. They usually can speak fluently, and they can usually read and write. About conduction aphasia, this is a rare form of aphasia. The person or the patient's expression and compensatories are intact. However, they still display an isolated impairment in their ability to repeat simple phrases and words. And here's just a video.
The producer asked us to count to 10. Remember that? Yes. Can you do that again? Why? 1, 2, 3, 4, 5, 7. Going to Gabriel's people. I can't. No, that's really hard. Let me get you started. I was done. Okay. 1, 2.
And you can go watch the rest on YouTube. So conduction aphasia is thought to be caused by in the arcuate fasciculus, a white matter tract that runs between Broca's and Wernicke's area, and thus is considered a disconnection syndrome because of the lesion in the articulate fasciculus is assumed to interrupt communication between the sensory and motor module of the classically defined speech and language system. And it's just a picture kind of showing things they may have trouble with, questions they may ask whenever they do not know what's going on.
Kayla, your mute is on.
So sorry. So global aphasia refers to a complete loss of comprehensive and expressive language. These individuals have impairments of comprehension in single words, sentences, and conversation, as well as extremely limited expressive language and repetition. So people with global aphasia have suffered damage to the parasylvian cortex, brain tissue around the sylvian fissure that divides the frontal and temporal lobes. This area contains both Wernicke's and Broca's areas, and the image down here just kind of shows you where the trauma would happen in global aphasia patient. You can see the perisylvian region, and you can also see the B and the W that stand for Broca's and Wernicke's area, just showing that both of those areas are affected. And next is mixed complement aphasia. And in these patients, they have sparse and effortful speech. And this kind of resembles a severe Broca's aphasia patient. But they also have limited comprehension of language. And unlike typical Broca's aphasia, patients have limited comprehension of language, similar to Wernicke's aphasia. These patients also have poor reading and writing skills. They typically will not read or write above an elementary level. So the assessment procedures for all types of aphasia are typically similar. Of course, before this, you start with the screening. After that screening, and you assume that they need a full evaluation, you'll start with their case history. That includes medical history, educational history, work history, communication, environment, status, and skills, and also the goals for the patient. You would also do a motor speech examination. They may have comorbidities such as dysarthria or dysphagia, so you would want to eliminate or include those in your diagnosis. You would also do a language evaluation in which the SLP will use testing, language samples, or other methods to try to evaluate expressive and comprehensive language, and that could include repetition, spontaneous speech, naming, discourse, etc. And you also want to cover their personal and environmental factors. So who they're communicating on a daily basis, their support, coming up with strategies for them and communication partners, comorbidities, and acceptance of this diagnosis, because that can be really hard to come to terms with. And I think that will conclude our slideshow.
Thanks.
Thanks for watching.
Have a great day.